SGTi-flex COVID-19 Antigen Self-Test Procedure Guide. Please see the instructions for use for details. Preparation before test. Wash your hands thoroughly for more than 20 seconds, using soap and warm water or hand sanitizer. Check the test kit contents. Make sure that nothing is damaged or broken. All samples and reagents should be stored at room temperature for 15 to 30 minutes prior to testing. Take a sample with a swab. Remove the sealing foil from the extraction buffer tube and place the extraction buffer tube in the packing box. Swab is in a sterile wrapper. Open the closed wrapper and take out the swab by holding the handle. Never touch the fabric tip of the swab with your hands. Carefully insert the entire absorption tip of the swab inside the nostril and firmly sample the nasal wall at least 4 times. Gently remove swab. Using the same swab, repeat steps in your other nostril. Test procedure. Put the swab into the extraction buffer tube and rotate it more than 5 times to allow extraction. Take the swab out by pressing and squeezing the sides of the tube to extract the remaining liquid from the swab. Put the dropping cap onto the extraction buffer tube. Make sure the dropping cap is on tight so that it cannot leak. Open the pouch and take out the test cassette. Place it on a flat, dry, and clean surface. Turn the extraction buffer tube integrated dropping cap upside down and slowly squeeze 3 drops onto the sample well of the test cassette. Please wait 15 minutes after adding the 3 drops to the sample well of the test cassette. Interpretation of results. Safety disposal. Australian sponsor and distributor, Involution Healthcare Proprietary Limited.